Welcome to Coordinating Client Care, Hudson Valley Community College. I'm Mrs. Lynn. Your reading assignment is found in ATI Nursing Leadership and Management Book, Edition 8.0, Chapter 2, Coordinating Client Care, pages 23 to 31. Objectives: identify the importance of receiving and giving handoff report. Collaborate with interpersonal team members. Use approved abbreviations and standard terminology when documenting care. Identify which documents are required when transferring, and describe the role of the nurse as an effective leader. Introduction: Coordinating Client Care. A primary nursing role is to coordinate and manage a client's care collaboratively with other members of the healthcare team. For the RN to effectively do this, they must fully understand the importance of collaborating as well as the role of the involved individuals. Team members from various groups may include the following: case management, discharge planning, consultations, referrals, and transfers. Introduction: Coordinating Client Care. A primary nursing role is to coordinate and manage a client's care collaboratively with other members of the healthcare team. For the RN to effectively do this, they must fully understand the importance of collaborating as well as the role of the involved individuals. Team members from various groups may include the following: case management, discharge planning, consultations, referrals, and transfers. Handoff report. Identify the importance of receiving and giving handoff report. Utilize communication tools such as SBAR and provide an opportunity for the next nurse to ask questions and to clarify the plan of care. Nurse to nurse handoff should be given in a private area, and the report will provide assessment data to the oncoming nurse. This information will be integral to changes in patient status. For instance, the nurse will clarify and reveal any new orders, changes, or procedures. What is an interprofessional team? The interprofessional team involves all healthcare providers who are involved in the care plan for the client. This may include the RN, the MD, a consulting specialist such as urology, case management, physical therapy, speech therapy, occupational therapy. In acute patient care, the patient may require a multidisciplinary team effort to provide system-based quality care. Remember to review the care plan daily, weekly, and before team meetings. Review care plan to ensure continuity of care across disciplines. What is the role of the nurse? Well, the nurse, she coordinates care, right? The nurse will coordinate care. The nurse will provide holistic understanding of the client and their needs. The nurse provides information during rounds and during team meetings. The nurse will arrange for the client to participate in the care plan. The nurse allows the opportunity for all disciplines to participate in system-based and holistic client care. And the nurse will anticipate discharge needs on admission. Remember, discharge starts the day of admission. The nurse is a resource person and an advocate. The nurse works collaboratively with team members and utilizes nursing interventions. We might as well say that the nurse knows a little bit about every role in the to do with the interpersonal professional team, and also all of under her scope of practice. Plus, she works collaboratively with all the different team members, so she knows a little bit about what's going on in all of these different fields. So, as you look at all the roles of the nurse, not only is she flexible, but she's multifaceted in all the roles and within the team itself. The nurse collaborates with interdisciplinary team members. The nurse collaborates with the team, provides information about client during the rounds, is an advocate, allows the opportunity for all disciplines to participate, and provides any pertinent nursing information during team meetings. Here's an example of a patient who has problems with their skin and with pain management. This is a report that a nurse has given. Example of a report on skin integrity. The patient or the client had stage 3 on the coccyx. Rinse with normal saline. Apply hydrocolloid over the alginate dressing. Improved pain from 6/10 to 2/10. Pre-medicated Tylenol 650 before dressing change 1 time a day. The interprofessional team involves all healthcare providers who are involved in the care plan for the client. This may include the RN, the MD, a consulting specialist, such as maybe urology, case management, discharge planning. Effective leadership, resource person, collaboration. What does it take? Well, it takes strong communication skills, assertiveness, skills in conflict resolution, leadership skills, critical thinking skills. How does the chain of command influence decision making? Collaborate with these interdisciplinary team members when delivering patient care. As the nurse, it is important to realize that collaborating with the interdisciplinary team allows success at reaching goals for the patient that they would not be able to do with one single professional team member. This is essential to understand how the team works together. Identifying the need for a disciplinary rounds. The nurse will act as a representative of the client when collaborating with the provider and other members of the team. Advocates for the client and family, coordinates care, especially for those with complex healthcare needs. These patients are going to have complex needs. Well, for instance, a trauma patient, someone who was in a motor vehicle accident. They have general surgery. They have maybe they had a head trauma. Maybe they have now skin issues. Maybe they have respiratory problems, speech problems, feeding problems. So they're going to need an entire team to bring this patient to the best outcome. The continuity of care is desired as the client moves from one level of care to another level of care. Needs are identified, and the needs they often change, and care is discussed within the team. Maybe now they're going to move to a step down or to another floor. They're going to go to another facility. This is going to involve still a team effort. It's essential to use approved abbreviations and standard of terminology when determining care. Check your place of employment for a list of approved abbreviations for documentation. Together, everyone achieves more. Assess the need for consults or referrals and obtain necessary orders. For instance, patient refuses to eat and has been found crying on numerous occasions. The client has stage 3 wound on her coccyx. The client is not able to make decisions about treatment plan. The nurse seeks a consult or referral for appropriate services such as in the following: nutrition, social worker, wound care, clergy, possibly psychiatry. These are examples of consults or referrals which could be obtained depending on the details of the case. Patient transfer. Which documents? Client medical diagnosis, list of providers' demographics, advance directives, notes, guiding the family involvement, what the patient can do or cannot do, perhaps written verbal report of the client's status, alterations, mobility, recent progress, plan of care, most recent medications, PRN last given, follow-up care, allergies, diet, most recent activities, need for special equipment, wound vac, oxygen, walker, adaptive equipment, and any religious or cultural beliefs that affects their care. And what do we know about the chain of command? How does the chain of command influence leadership? We want to strive for balance. We want to strive for balance to improve outcomes. So centralized hierarchy, the nurses who are on the top of the professional ladder usually make the decisions. This is called centralized hierarchy. Decentralized hierarchy, the staff who are at the bedside. With a centralized hierarchy, the nurses who are at the top of the professional ladder make most of the decisions. The decentralized hierarchy are the staff who are at the bedside. Decentralized hierarchy leadership has been demonstrated to increase job satisfaction and staff retention. Which is best? Strive for balance to improve outcomes. It's always balance. When discussing leadership styles, we want to include strong communication skills, assertiveness, skills in conflict resolution, leadership skills, critical thinking skills, and how does the chain of command influence decision making? We want to utilize these skills to the best of our abilities to have balance and to achieve the best outcomes.
Collaboration of care. Meet Sue. Which interprofessional team members will Sue need for the best outcome? Sue is a 40-year-old Hispanic female client who was admitted to the acute care unit community hospital following a fall. She sustained a left hip fracture and a left-sided cardiovascular stroke. She is now on day 2 status post left hip arthroplasty. In addition, Sue is having trouble swallowing and speaking clearly. Which team members are involved in her care?
A team approach for Sue. What are the priorities for Sue's healthcare team at this time? The nurse-provider collaboration. Collaboration between nurses with different areas of expertise, and collaboration between the interpersonal team, the client, and the family.
A team approach for Sue. What are the priorities for Sue's healthcare team at this time? The nurse-provider collaboration. Collaboration between nurses with different areas of expertise, and collaboration between interprofessional team, client, and family. Critical pathways or care map. The implementation of clinical guidelines and protocols. Tools which are based on cost and length of stay and treatments. Document as a variance when a client requires treatment other than what is typical or requires a longer stay. The interdisciplinary team approach for Sue may include the RN, an orthopedic surgeon, speech therapist, social worker, occupational therapist, physical therapist.
Interdisciplinary team goals. Education is ongoing. Starts on admission and ends when the client leaves. Nurses collaborate during this time with interdisciplinary team members. Nurses educate and collaborate. Responsibility and collaboration includes the nurse, the primary care physicians or the consultants, the friends, family, technology, treatment options, support groups. We utilize all of these in our collaboration. Remember, patient-centered. What about generational differences among interpersonal team members? Remember, various learners are classified into categories such as veterans, baby boomers, Generation X, Generation Y, and Generation Z. Be aware that each team member and client may have different learning preferences. For instance, generational differences can be challenging and can bring strength to the team at the same time as vulnerabilities. Baby boomers, for instance, born between 1946 and 1964, prefer classical lectures and workshops, whereas Generation X, which were born about 1965 to 1980, they're more traditional learners. And then Generational Y, 1981 to 1996, prefer e-learning and using activities. Generational Z 1997 to 2015, they prefer platforms like TikTok, YouTube, mobile phones. Magnet recognition. What is it? It's a pathway to excellent recognition. The American Nurses Credentialing Center awards magnet recognition to healthcare facilities that provide high-quality client care and attract and retain well-qualified nurses. They provide continuity of care, which refers to the consistency of care provided as clients move through the healthcare system. It demonstrates a culture of empowerment. They model the transformational leadership, and they demonstrate empirical data demonstrating quality of results. They model exemplary nursing practice. Become a team member, and you'll see great outcomes.